Let's take a look at the customizability of the CS3D viewing software and how we can use some of the features from the software, and in this case, this Carestream Dental CS9600 CBCT system, to present impressive treatment plans and help relate them better to patients. The CS3D viewing software is widely regarded in the dental industry to be at least among the easiest to use comparatively. It is robust, feature-packed, and free for everyone. You can go to www.carestreamdental.com and receive a full version of the software without the need for purchasing a license. This is just one part of what makes us so popular in the specialist market. There are some moduled add-ons that may be of interest to you, and we will cover a couple in this video. Carestream Dental CBCTs acquire natively in DICOM format. Users enjoy a very simple process to export volumes for use in third-party software. You will be challenged to find another manufacturer that makes it easier than Carestream Dental does. Here we're looking at the radiographs, also called MPR views, and the 3D reconstruction taken with the CS9600 CBCT system. In the upper left, you can see some tools that allow us to easily change what we see. We have an MPR adjustments button and a 3D adjustments button. In the MPR views, we can easily change the brightness and the contrast and the thickness of the slice. This allows us to adjust views for various indications. In the 3D reconstruction, we're already getting a great view of the bone, but we can improve on this and create some visuals that will help set yourself apart from others. In the 3D adjustments tools, we can make adjustments to opacity to better see the roots. We can also change the values with specific densities, which generally correlate to different kinds of tissue and bone. Here we have skin, flesh, bone, dentin, enamel, and amalgam. You can change these values to see different things, or highlight certain areas. For example, in this full cranial scan, we can see the osteomeatal complex in the coronal view of the MPR views, but we are unable to see this with the 3D reconstruction. We can see this in the 3D reconstruction by doing the following. In the oblique slicing tab, you'll find a cropping box in the tool section on the left. Select this cropping box and boxes will appear in each of the MPR views. In the sagittal view, drag the box from the anterior to the posterior until you get to the osteomeatal complex. You still can't see anything. And by simply changing the view to shiny bone in the 3D adjustments from this drop-down menu and adjusting the flesh toggle to about 40, we will be able to not only see the turbinates and the meatus, but see right through the inferior and middle meatus to the nasopharynx. As I continue to increase the flesh value all the way up, the blue in the maxillary sinus provides a three-dimensional view of not only the floor of the maxillary sinus from the superior perspective, but as I slice through with the cropping box, we can see some mucosal thickening on the right side, shown by the red bump. This view can easily be saved in the Carestream Dental imaging software as clinical documentation in each of these workspaces by selecting this drop-down menu here where this disc is and selecting the camera icon. This has now saved this view. Once you have a view that you like and you'd like to save it for easy reference later on, we can do that simply by going to the 3D adjustments button. This little circle here with the plus says Display Palette Manager dialog. Select this, click on Create Palette, name it whatever you want, and then click on OK. Now, this will be saved into the 3D viewing software for easy selection later. The CS9600 is also capable of an optical scan of the patient's face, which is stored in the Carestream dental imaging software along with the CBCT volume and intraoral scans. The CS face scan from the CS9600 is capable of automatically aligning with the 3D reconstruction. Combining all of this information really helps to create an impressive visual. Patients will feel like they're a part of the future, and it can interrupt normal patterns that influence decision making, helping to frame information in context that's impactful and in a way that they remember so that it's easier to make decisions based on overall value. Not everyone needs this, but it's helpful to many who experience barriers to decision making when sophisticated information is presented. Now let's take a look at what it looks like to add models to the scan. They're stored in the imaging software, and as long as they're connected, we will be able to overlay them onto the 3D reconstruction automatically in a very similar manner to the face scan that you observed earlier. So let's add those on there right now. So now what we have are optical scans that were taken from an intraoral scanner on the CBCT. We have the teeth and their associated roots. And we've got a lot more information. The CS9600 and our other CBCTs in the CS3D viewing software are also capable of volumetric airway analysis, which I'm not going to show in this video. But think about what this means to the comprehensive connection between sinus, airway, arched shape as it relates to implants, orthodontics, and more, and how you can visualize all of this information together in the CS3D viewing software with the CS9600 CBCT. I hope this helps you all out. I hope this helps you create new and better, more impactful case presentations with your patients. This is Dan from Carestream Dental. Take care.